So, for those who've just come on, very warm welcome to you. My name's Tom Lawton from Fifth Sense, running these sessions, Let's Talk Smell Taste. Today, very happy to announce that we have one of our first sessions, because these sessions are being really pushed by circumstances, and we've really found a value in the online community, especially how we can share our experiences around the globe. This is not a condition that respects borders. Today we'll be having time, I'm going to hand over as quick as possible to Cath Rennie, an ENT consultant, and much more. She'll be taking you through the highlights of her career and her interest and her engagement with smell and taste disorders. And also Lizzie Bullock, who works with her, and Lizzie will be also sharing her personal experience as well. CNS stands for Clinical Nurse Specialist. Thank you. So with that, very warm welcome. If I can introduce, and over to you, Cath.
Great, thank you very much for introducing everybody, Tom. Great to see so many people on the call today, and from all over the world as well, which is fantastic. I had no idea that we'd have everybody from all corners of the globe, so that's really nice to see. I'm an ENT surgeon myself. I did my training in London and a post-training fellowship, and I currently work in Charing Cross Hospital in London, part of Imperial College Healthcare Trust, and I specialise in rhinology, so noses. Most of my research has been in noses, and we're just undertaking some research on COVID with olfactory dysfunction. So Lizzie and I work together at Charing Cross, and we've been looking at a number of people suffering from olfactory disruption due to COVID infections. I'll pass over to Lizzie, who'll tell you a little bit about herself, and then we'll give you a bit of a background to where we are. So Lizzie, do you want to just tell us who you are and what you're doing?
So again, my name's Lizzie. I qualified as a nurse in 2014. My main background is in operating theatre nursing, but I've now moved into a role as the Rhinology Nurse Specialist, where I act as the main, the first point of contact for patients, help to organise appointments, arranging surgery, and I also see patients in my own clinic with various nose-related issues. A bit about my experience in anosmia now.
I'll just give a bit of background first, maybe, Lizzie. So we started really thinking about anosmia with COVID back in March, when I began to see loads of patients suddenly being referred to me with a loss of sense of smell. I've always seen patients with a loss of sense of smell, but never in the numbers that started coming through kind of February, March time in London, which really raised alarm bells about, was there something going on with COVID and loss of sense of smell? Doctor colleagues of mine in Iran and Italy had also been talking about a loss of sense of smell with COVID, and we're all beginning to wonder, was COVID-19 damaging smell and taste in some way that we didn't know about? And through quite a lot of international collaboration, we eventually began to see that COVID-19 was in fact impacting on sense of smell and taste, and it was likely to be causing this. And of the people kind of February, March, April, who were developing a loss of sense of smell, when they were tested for COVID, about 19 out of 20 of them were actually positive for COVID-19 infection, which is huge. And of all patients who had COVID-19, about 50% of them had a loss of smell and taste, which is huge numbers of people suffering, more than we'd ever seen in our rhinology clinics before. We were finding that it was more commonly mild COVID infection that was associated with the loss of smell and taste. And of the more severe COVID infections, only a third of them were reporting loss of smell and taste. But that may be because they were too unwell to pick up on the smell and taste. It was a more minor symptom of theirs. It was more common in women that we were seeing, and it tended to be more common in younger patients. And it was really very rare in children. We didn't see it at all in the under 10s. But the good news about it was that about 90% of people did seem to be recovering quickly, usually in about 2 weeks. And we think that what was happening is the olfactory epithelium, so the area of the nose that picks up odours in the top part of the nose, was being affected by the virus. Of the 10% that had longer lasting loss of sense of smell, we found many of these were developing distorted sense of smells, or with parosmia, which many of you will know about and we'll talk about a little bit later. The good news about this is it did seem to be suggesting that these patients were on the road to recovery. So that was quite interesting to see. But if we think about it in terms of COVID in general, more than 10 million people globally have been diagnosed with COVID-19 now. And of those, about 5 million lost their sense of smell and taste. So that's huge numbers. And if we even think about those, most were obviously temporary loss, but even those who had persistent loss, we're looking at about 500,000 patients with ongoing problems with sense of smell and taste. So a massive increase of awareness of anosmia. I'm pleased that the WHO finally put it on their list of symptoms, although it was later than most our rhinologists would have liked. Equally, Public Health England seemed to be quite slow in responding, although eventually got there, and it was included in the COVID symptom screening. But at the time when we were looking at this, the access to ENT surgeons was restricted because in the hospitals we were mainly closed down to acute chest emergencies. So people with loss of sense of smell were really having problems accessing ENT surgeons or even GPs. And many GPs didn't have much experience in treating loss of sense of smell or taste. So I hope that what we go through today will give you some things that you can look at to help yourself, or where to access information to find out more about these things, and perhaps give some tips on where we are. I'll move over to Lizzie, because although she's our rhinology specialist nurse, Lizzie actually got COVID herself back in March and lost her sense of smell. So she's somebody who can really empathise with the patients about this now.
So I was diagnosed in March. The first symptom I got was a mild cough that went on for a couple of days, and then on day 3, maybe slight cold symptoms, but then complete anosmia. I did start to think that doesn't really add up to how my nose feels, and got a test and sure enough was positive. Then after 3 weeks, still very minimal recovery, even though other people that I knew had experienced it had recovered fully. I began nasal rinsing, or douching as some people like to call it. I bought lipoic acid tablets, and I began smell training. It's been slow progression. I've had some recovery, I'd say subjectively around 40% in comparison to what I thought I smelled before. But all sorts of things have gone on in the process, like the most recent happening. I've become very hypersensitive to garlic. So I can smell garlic from afar, like from upstairs if someone's cooking it or whatever. But in comparison to other smells, which I can't smell at all, like bad smells, I'm pretty much still anosmic. Good smells though, I am progressing. So it has been a patchy recovery, to say the least. But I'd say I'm going to continue with my smell training. I'm hoping that that's the thing that's driving this forward, and that as time goes on, because it can take up to a year for the recovery of the nerve, that I still have some way to go, and I could get further up than 40%.
Thank you, Lizzie. And you pulled out a lot of themes in there, which I'm sure will be very familiar to a lot of people. One is that it's not straightforward. It's not a case of sort of simple, it switches off and then a simple recovery. The recovery can come partially. The smells which come out can be very different for different people. We probably have as many experiences of our smell and taste loss here in the group as there are people here. It's almost never meet two people who've got exactly the same sets. Yours, by the way, actually mirrors almost exactly my experience of smell and taste. I've had for a very long time now, with certain smells pop out and others don't.
Yeah.
Thank you. So lots of different experiences. And I'm kind of just curious to know, just before we head into that, is I'd just be curious on a personal note, just how has that changed your thoughts about anosmia? Because as in somebody who's been working closely with anosmics for so long.
Obviously I couldn't relate before quite as I can now, and I used to sort of think, oh, of all the senses, smells, you know, it's not a terrible thing to lose. Until you do lose it, it's like being blind in your nose. You just think someone will say, "Oh gosh, can you smell that?" And I'm thinking, no, not at all. And you start to just wonder what your awareness is in comparison to other people, and it almost causes paranoia in a way, I suppose. But you do get used to it, but still I do miss it.
Cath, some experiences there about sort of intermittence or maybe even getting headaches from it. Any thoughts about what adjustments people can make to get the benefits of this?
It's quite classic to have intermittent return in the sense of smell. It doesn't come back and stay back generally. Often it's an up and down path as things improve. If you've had some improvement and then it disappears, then that's a really positive thing, and it is likely to improve again. So that's something worth persisting with. Obviously, if you're getting a headache after 5 minutes of smelling something, I would give up. I wouldn't persist with that. Probably not the way forward for you. But for many people, it can take a long time, and it is the one thing that people can do, or at least try, that does have some benefit. I know Lizzie's been doing her smell training at home, and she initially had a response to it and now feels like it's plateaued and not really improving. I don't know, Lizzie, do you want to tell us how you found it?
It's quite difficult because you have to set out quite an amount of time in the morning and the evening, because you're supposed to leave sort of 30 seconds to a minute between each smell. Trying to do that in the midst of getting ready, or even trying to set aside some time to do it, isn't the easiest. But I did notice like a gradual curve, an uphill trend, and then unfortunately I've come to a plateau now, but it doesn't mean I'm going to give up with it, because I do think in the long term it could continue to benefit me.
The reason we recommend the essential oils is that was what the original research on smell training was done on. By no means is that the be all and end all though, or the only thing you should use. Certainly if you are getting some sense of smell from something else, I'd encourage you to continue using that and try frequently smelling that, or trying other different smells. I've got no problem with you using herbs. Some people, as I said, smell oranges. Some people like the smell of coffee. Some people find the coffee is awful. So it's about tailoring it to what works for you, really. There's not an absolute on it. And the reason, as I said, that they've chosen those 4 essential oils is that was what the original research on this was using. And we've got to remember with this, all the research that was done on anosmia post-viruses was done before COVID existed. And we don't know whether everything for COVID anosmia will be exactly the same as what we had before. And this is something that we're developing as we go and learning more and more about as we find out about people's symptoms with it.
Thank you. So another area of management then you said it was around?
Yeah, so I was talking about nasal health and how to maintain a healthy nose generally. And many of you will probably be aware, I think Lizzie mentioned it, nasal rinsing or nasal douching. And this is something I recommend for most of my patients anyway. People with nasal allergy, who've got allergens or pollen in their nose, it's really helpful to rinse the nose out every day, twice a day with salty water. And just things that are causing inflammation in the nose, or if there are chemicals in the nose that are causing problems, then just a rinse out with salty water will remove those things that could be causing any potential inflammation and help the health of the nose. Also inside your nose, in the lining, you've got these little cilia that waft the mucus backwards. And if they get covered in thick, sticky mucus, then they don't work as well. So by flushing it out regularly, that can really benefit the nasal health and help with taking down any inflammation that could be impacting on the olfactory cleft, which is that area at the top of the nose where all the olfactory epithelium is. So that's the area that picks up the sense of smell. And by keeping that area as clear and as healthy as you can, it gives the greatest chance of each of those odor molecules landing in the right place in order to trigger a sense of smell. It takes a bit of getting used to with nasal douching. I mean, you've got to make sure the water is not too hot or too cold. If you have cold water you flush through your nose, you'll get an ice cream headache, and I'd advise against doing that. And obviously you don't want to burn the lining of your nose either. Most of the rinses have some sort of salt solution in them, so Some people just put half a teaspoon of salt in 200 mils of water and rinse it through. There are a number of over-the-counter preparations that people can buy. One of the common popular ones is the NeilMed Sinus Rinse Douche that many of my patients use post-operatively when they've got a lot of blood clot and things in their nose when they've had sinus surgery. But certainly all the people with allergies and things like that, we'd like them to use some sort of rinse. There are saltwater nasal sprays available, which again are helpful at just flushing out the nasal lining and making sure there's not kind of a blockage in there that is causing the problem to the sense of smell. Lizzie, you're doing NeilMed Sinus Rinse Douche daily at the moment, aren't you? How have you found it? And I don't know if anybody else here is as well.
I actually think it's brilliant in bringing, it's far more effective than blowing your nose or whatever, isn't it? Like there's like a sensation when you first apply it of like it's filling up your nose and you think, oh God, where's this going to go? And then sure enough, it comes out the other nostril. I can't say the process is, I can't say I love it, but at the end, I do like the result. It makes your nose feel very clean.
Could you give us just a 30-second overview of the connection in between smell loss and taste loss and what that is? Because I think sometimes when we're working in fifth sense, because we're so immersed in this, we can lose sight of the fact that, you know, sometimes making those connections isn't necessarily something that everybody's at the same starting point.
Yeah, so our senses of smell and taste are very interconnected and overlap hugely. A lot of what we perceive as taste actually comes through our sense of smell. So while we perceive certain tastes very clearly, the nuances with each of those tastes is often due to the smells that we're getting from olfaction or smell that goes up the back of the nose while you're eating or chewing that makes you aware of those like slight differences in different sweet flavors or in different kind of spices that you're aware of as you eat them. So a loss of sense of smell is frequently associated with a loss or altered taste as well. And a lot of that is due to that overlap and smell contributing so much to different tastes. So by doing smell training, if you are able to improve your sense of smell, then certainly some taste does improve with that as well. So it's the link and overlap that's really important there. With COVID-19, we have seen some chemesthesia, so some differences in taste, and we wonder if it does work slightly differently to other viruses. But that's certainly research that's going on at the moment, because some people have a feeling of burning in their mouth and different things like that, which is really very different to the usual loss of sense of smell that we find with post-viral loss of sense of smell. So there are a few nuances with COVID-19 that haven't really been worked out yet. But as a general, there's a huge overlap between both. Some people think their taste stays the same with no loss of smell, but most people who have a lost sense of smell, their taste does dampen down somewhat with that. Would you agree, Tom? How was yours?
My connection between
Your
sorry,
smell
you caught me just checking all the messages in the chat box.
Sorry.
I was up to date with everyone. The connection between my sense of taste and my sense of smell, yeah, very, very, very closely linked. It's something that's my sense of basic tense, my perception of sweet, sour, salty, etc. I realized only once I got in contact with fifth sense, because I put so much attention on it. Actually, it's very, very sensitive. So I have a very, very quick ability to be able to test if something's, you know, undersalted or over sweet, for example. I have very vivid experiences of those basic 5 tastes. Also, if it's too watery or it's soapy, all that stuff that I can taste in my mouth. I'm hyposmic. I have partial smell loss. But all that, you know, I can eat a strawberry and tell if it's sweet enough or sour, but all the strawberryness of strawberry is pretty well lost for me. So that's a way I sort of split up the two. But actually, the more I put into focusing on what I can taste on my tongue, there's a lot there. And actually, I can tell if milk is about to go off before my wife can smell it, because it changes how the experience on the tongue. It gets a slight acidity to it that wasn't there before. So there's a kind of it feels like a very limited world. It feels like a very second best world. My smell loss happened in 1990 and I miss it every day. but I will say that there is a rich world of tastes to which I have been exploring.
When we're looking at post-viral anosmia, we're looking at kind of nerve damage or damage to the olfactory region. And I see your question, by using a saltwater rinse, how are you going to improve that? Certainly, if you've got any inflammation in the nose or any narrowing, it will make the area that has olfactory cells on it and fibers a lot smaller and narrower than it might be. So even if you've got a clear nose, there's certainly going to be no harm in using a nasal douche. And rinsing your nose is really, really helpful, because it's not going to do you any harm whatsoever. You can get rid of any pollen that might cause any, even mild inflammation. And there's not really, other than taking time, many downsides associated with it. So if it keeps your nose really clear for you, it makes the olfactory region as open as it can possibly be, gets your cilia and olfactory mucosa, so the lining, working really effectively, then I think you're putting yourself in the best possible place you can be to try and train the olfactory region to start working again if possible. Usually the most effective time to try the smell training is early on. Similarly with the douching, if you've been anosmic for 10 years, trying to get sense of smell back later than that, obviously the chances of it returning are lower, but we always do get the occasional story where somebody who hasn't had sense of smell for a long time, and it may return, or things do come back and they are able to perceive things. So I wouldn't totally give up hope on it. There are stories out there that have been, you know, coming out every now and again that always surprise us. But as you say, if there's long-standing olfactory damage, then the chances of things returning obviously are much lower than if it's a new onset thing that we are able to work towards. Certainly with the parosmia that many people are getting post-COVID, they're finding what they would normally eat, they don't even want to prepare or cook in the kitchen, because it makes them actually feel really unwell doing it. So a number of our patients we've actually got eating really basic, bland things to start with. And even though the sense of smell feels like it's dropping at the moment, the fact that there is some smell there means that I wouldn't give up hope about it at all. And we often tell people with parosmia, often that's the first sign of things recovering in an anosmic patient. So it's not that it's going to get worse and continue to deteriorate. The fact that there's something there is a good sign. In terms of diet and what we get people to do, it's a bland diet, and some people just like having things like pasta and rice or toast to avoid any of the things that kick things off, because many people find coffee, meat, onions, garlic are really unpalatable with the parosmia. Obviously it varies from patient to patient what they experience, but it's quite common that we're finding things like that. And some people, their parosmia is actually so bad that they're down to having kind of unflavored protein shakes, as it's the only thing they can keep down without feeling really nauseous and sick. And hopefully as things improve and they begin to build things up, this will just be temporary and they'll be able to work through it. And that seems to be the way most people on the kind of help groups and things that I've been involved with are saying, and certainly patients in our study seem to get through it. But it's starting with really simple things and gradually building it up. I don't know if other people have had similar experience. In terms of age, we're not finding a particular difference in age so far. But as I say, for post-COVID anosmia, we're still in really early days. For post-viral anosmia, there seem to be a wide range of ages affected with it. With COVID, it seems to be a younger population affected by it. But whether this has an impact on recovery, we're not sure as yet. As I say, the virus has only really been properly recorded in the UK since March. So in terms of when we find out about that, will probably be more like a year down the line. But in terms of research, I'll probably talk about this a little bit later, but there are a number of studies going on looking at smell disruption in COVID-19 infections, and they're looking at recovery over time. Some are focusing on healthcare workers and others are focusing on anybody who's had a PCR swab positive. No, there's a huge range of things available for treating any nasal condition, and most of them have been tried in anosmia to some degree or another. There's not much evidence for many of them, but there is some evidence for some. When people initially present with loss of sense of smell, many people go to a pharmacy and look at what's available over the counter first off and see what they can use. So things like the douches are picked up quite frequently, and that's a great thing to get going with. But many people also try nasal decongestant sprays that decongest the nose and help people breathe through it more clearly. COVID doesn't really, the anosmia doesn't really usually seem to be linked with much nasal blockage. It's often they can breathe clearly through the nose. So using something like a decongestant, we wouldn't recommend in COVID anosmia or COVID related anosmia. And decongestant sprays or even decongestant tablets, we tend to only recommend using them for 1 or 2 days rather than using them for a longer time than that, because they can actually cause a change in the nasal mucosa, which means that you become more blocked the more frequently you use them. So that's something to avoid if possible. The next thing that we've often looked at is steroids. So steroids can come as topical nasal sprays, nasal drops, or even oral steroids. And topical nasal steroids are commonly used, particularly in post-COVID anosmia. We don't tend to give it initially during the acute infection because people want to avoid steroids around the time you've got a really severe COVID infection, because it can potentially cause immunosuppression, particularly oral steroids. But certainly a week after the start of symptoms, starting on a steroid nasal spray is something that we would recommend that patients do. And that's something that you can buy over the counter. Things like Beckinase and Pyranase, which have got fluticasone or betamethasone in, are topical nasal steroids. The idea of using these is that they can take down inflammation and open up that olfactory region more clearly, take inflammation down around the nerve, and hopefully improve access to the nasal mucosa. Nasal drops, which are things like Flixinase nasals or Betnazole nasal drops. Flixinase nasals have got fluticasone in them, and they are prescribed then. So that would be something you would get from a GP or an ENT surgeon, and they reduce inflammation in the nasal cavity. There's a method of putting them in so that they reach the olfactory region more easily. It's the Cath technique, where you lay down, turn your head to the side and drop the drops in to try and reach them up to the olfactory region. And when we talk about anosmia, we talk about it as kind of a nerve sensory neural type of thing, or a conductive, so blockage in the nose. And the blockage can potentially be alleviated by using the steroid drops, which is one of the reasons we like to try it in patients with anosmia. The oral steroids, as I said, is something that we've avoided using in COVID patients, and that's because of potential immunosuppression and making them more susceptible to worse disease. I know steroids are being used on very unwell patients who are intubated on intensive care units with really severe COVID, but that's at a different level of infection. The patient's already immunosuppressed by their infection, and they're using the steroid for a different reason then. So tablet steroids is something we're trying to avoid when there's an acute infection, but certainly in recovery, about 6 weeks after having a COVID infection, some people have tried oral steroids then to see if it improves their recovery, but the jury's out on it. Evidence is lacking on that at the moment. So what I would recommend for my patients is that they do try a steroid nasal spray. I wouldn't have a problem at 6 weeks later if they wanted to try an oral steroid, but I don't know that there would be much benefit necessarily, and there are potentially complications from taking steroids. So they have side effects associated with them. People don't sleep well when they're on steroids. Appetite is increased. They have potential risk of gastrointestinal side effects, so stomach ulcers and things like that. So it's not something that we would think about giving to everybody, and certainly only in certain cases would we look at oral steroids. Yeah, so if you're on medication, I would certainly read carefully what the interactions are and side effects and things before you start using any of these things. Steroid nasal sprays do interact with other medications that people may be taking. I know they interact, for example, with antiretroviral medication. So even something simple that you can buy over the counter, do check the side effects on it before taking it. And if you have concerns, contact your general practitioner if you're on many other medications as well, as they'll be able to give you clearer advice that's specified to you with what your comorbidities are and why you're taking other medication. Similarly with the supplements, some of the supplements do interact with things. So again, check what you're taking and make sure that it's safe. If you have queries or questions about it, do run it through your general practitioner and get advice on it if you're concerned about taking it, because we wouldn't want it to lessen the effect of another medication you're taking. And when we're talking about supplements, there are things that they have done some trials on in basic sciences, but there's very little evidence for these supplements clinically at the moment. There are many trials where we're looking at using different ones. For example, in basic science experiments, it looks like vitamin A may improve their olfactory regeneration, but this hasn't been proven in clinical evidence yet. So many people are trying it, and we're unsure whether it will actually work or not. So vitamin A is something that is available. It comes as drops. There's some advice. I think Fifth Sense has got some on their website. People also try omega-3 as well as a dietary supplement. It can be bought in Holland and Barrett. Again, evidence on that is there's no evidence to say it's particularly effective at the moment. As I say, even in this condition, we're in the early stages of working out what works and what doesn't. And everything that we're using at the moment has been tried on different post-viral infections in the past. So we may not be treating the same condition with them. And certainly as we find out more, and that's why it's good to have everybody's feedback on what's worked for them. And that's why we're doing these studies, to find out how people's smell is recovering, what they're using, and whether it's getting any better with that or not. The other one was alpha lipoic acid, which I think Lizzie said she took. And that comes from some of Thomas Hummel's research in Germany. And he's, again, done some basic science research on it. But again, the evidence on it is lacking. So I wouldn't recommend it. I'd say it's a possibility, but do check up on side effects if you are on other medications to make sure you're not going to have problems. So we started a trial that we're running at Imperial, Cambridge and in Cornwall at the moment. Lizzie is recruiting for us at Imperial. It's looking at olfactory dysfunction in COVID. And we're looking for patients who've had a COVID test that is positive within the last month to 6 weeks. So unfortunately for many people, I know that this is, they're not eligible because their COVID symptoms developed before that, but certainly anybody new coming up with, who's getting COVID swab positive and is anosmic, we are recruiting them to our study. And what our study does is we're doing questionnaires and smell testing on them when we first recruit them to the study, then at 3 months, then 6, 9 and 12 months to look at what is happening during their recovery, how long it's taking, what's changing. And we're also looking at the different treatments people are using on this recovery pathway. So we're not recommending a specific treatment, but we're getting feedback on what people have used. So it will be really interesting to see the results of that. Certainly we are recruiting already, and if people are interested in joining this study with us, Lizzie is the person to go to, who's our research nurse as well as our clinical nurse specialist, and she's quite annoyed that she is actually ineligible for the study herself because her COVID was too early, and she's really keen to be doing all her smell testing as well. But anybody who's PCR positive within, which is the COVID test or the swab test positive within the last 6 weeks, we would really encourage them to get in touch, or if you know people who are testing positive now and have lost their smell, then it would be great to get them involved in it and just see what the pattern of recovery is over a year in these people prospectively as a cohort study. It's really simple to get involved because it's all done from home. We post the tests out to you or email them. You just fill in questionnaires, and the test itself is an upsit test, which is a scratch and sniff test. So you smell all these different smells, and then say what you think they are from a choice on the piece of paper, and then you post that back to us in a stamped addressed envelope we've already sent out to you. So it's not something that involves a commitment of coming into hospital, it's something you can do from home, and it's just done postal or via email for the questionnaires. Lizzie's email address is elizabeth.bullock@nhs.net. We will put that on the chat, and if there's anybody interested, then I'd encourage you to email Lizzie, because it would be great to get people involved in this, because it's certainly something that's an increasing area of research, and hopefully will give us some answers to some of the questions all of you have been coming up with. And I keep telling you it's early days and we don't know, but hopefully at the end of the study we'll have a bit more to be able to feed back.
Is that an antibody test or an actual COVID test?
A COVID swab test or an antibody test, but the antibody test would have to be that they'd had symptoms or been diagnosed within the last 6 weeks.
Okay.
So we want to follow the progress from being diagnosed with COVID and starting your anosmia journey going forward. So many people who are already 5 months down the line, like Lizzie, for example, unfortunately, at the moment, we're not able to recruit. But if we don't get a second wave of COVID, then we may end up having to recruit those people in order to meet our numbers. So hopefully, if COVID stays low, we can increase our inclusion criteria, but that's to be decided as yet. The Fifth Sense website is excellent. It's got a huge list of clinicians there who do have an interest in loss of sense of smell, based all around the UK, so you can see who's close in your region. And if you go to your GP armed with that information and ask for a referral to a specific person who's local to you, that would increase your chances of being referred. I know many GPs aren't seeing many patients face-to-face at the moment unless it's emergencies. Many are just doing virtual consultations, but certainly knowing who and where the clinician is and who you could potentially be referred to about it is really helpful as a first step. The problem with many people in general practice is they have limited experience of anosmia. As a doctor, your training in ENT is quite small anyway. Many medical schools have removed a lot of ENT from the curriculum, and in general practice you don't actually have to do ENT to train as a GP. There will be some basic ENT knowledge and questions on treating infections, but things like anosmia are quite specialised in ENT, and it's a few people who specialise in the nose that would perhaps know more than others about it. Hopefully, obviously, this is changing, and having anosmia linked to COVID has actually increased everybody's awareness about loss of sense of smell, I think, throughout the UK at the moment. And that, I think, can only be a good thing in terms of getting the right referral pathways going. There is also information on the Fifth Sense site about what you can do yourself and how to start doing things like smell training and nasal douching. But as I say, there is a list of people there. If you have a particular problem, then you should be able to ask your GP to refer through. But even within the hospital, we're not back up to running all our face-to-face appointments. I'm reduced to probably seeing a third of the patients I saw pre-COVID because of distancing rules and spacing and things like that. So things are still tricky at the moment. It will take a long time to recover to getting up to that number of face-to-face appointments again. So do bear with us. It will take some time to get referral pathways working efficiently, but certainly there is information now available online that can help, and most people are able to email answer questions or do a small virtual consultation.